Right now, the pressure is on. With cases and deaths still surging, COVID vaccinations are more urgent than ever. But there's a problem across the country.
This has got to be a 7-day-a-week, 24/7 reality going forward.
The United States is playing catch-up. Demands aren't being met. Rollout has been too slow. Warnings now it could get worse before it gets better. And those new variants, could they undermine shots in the arm? Plus, a new vaccination frontrunner.
It doesn't have any of the Catholic ethical dilemmas of association with aborted fetal cell.
But when is your turn? Questions about how and where, and encouragement from the bishop who got it before everyone else. You'll hear from him. And a moral obligation. That's what Pope Francis calls the shots. He's already gotten his and hopes you will do the same. All your vaccine questions answered on this special edition of Currents News.
We're going to defeat the coronavirus, starting with the biggest vaccination effort in the history of New York City. And that goes into full gear right now.
New Yorkers were quickly infected by the thousands, but now that vaccines are rolling out, critics warn the vaccination process is moving way too slowly. Hello, I'm Christine Persichetti. Are we seeing the beginning of the end to this deadly pandemic? Over the next half hour, we'll highlight some of the most newsworthy developments in our fight against COVID. Experts say the city needs to vaccinate 10 to 20% of the population before we'll see a drop in infections, but that's still a long way off. Much of the state's vaccine reserves haven't even made their way into New Yorkers' arms. Politicians and the public calling for 24-hour distribution centers, saying if this truly is the city that doesn't sleep, let's act like it. Currents News' Emily Druby reports.
The sound of cameras as Sandra Lindsay got her second COVID-19 shot.
Thank you.
Just 3 weeks after she became the country's first vaccinated nurse. She says she's gotten a lot of support.
Complete strangers who want to just thank me for my bravery and encourage me, people who are praying for me.
Non-hospital healthcare workers began receiving their vaccines, but these hopeful milestones overshadowed by calls from many gravely concerned over what's being called a slow rollout of the vaccine. Only about 200,000 New Yorkers have gotten the first of 2 shots.
It's very piecemeal. There's no organized information coming down from the state or from the health department. It's sort of like information passed in a back alley.
Pediatrician Dr. Eric Levine says non-hospital healthcare workers have had to resort to getting vaccine information from Facebook and WhatsApp groups instead of the government, adding the state should be using more medical professionals to help with distribution, not just hospitals, which are also now dealing with more COVID cases.
Also, better yet, send me the vaccine. For pediatricians, we are good at mass vaccinations. We vaccinate kids every day.
New York City has yet to open any large-scale vaccination sites.
This has got to be a 7-day-a-week, 24/7 reality going forward.
Mayor Bill de Blasio announcing the opening of 3 vaccine hubs by Sunday, January 10th in Queens, Brooklyn, and the Bronx, while Governor Andrew Cuomo placing the blame for the slow rollout on a federal program that was supposed to deal with nursing homes and on hospitals.
We want those vaccines in people's arms.
Northwell Health was praised by Cuomo for their high rates. Their CEO says while they're placing a strong emphasis on distribution, they're also still dealing with the normal hurdles of running a hospital and, just like Dr. Levine mentioned, rising COVID cases.
This is complex, but the goal is to move as quickly as possible, as effectively as possible, and as equitably as possible.
Emily Druby, Currents News.
And still ahead in this newscast, that first vaccinated nurse in America, Sandra Lindsay, speaks with us and tells us how she's feeling now that she's fully inoculated against COVID-19. That's still ahead in this newscast. Since the vaccine rollout began, Catholics had questions about the ethical implications of the shots. According to Bishop Joseph Strickland of Tyler, Texas, they both contain morally compromised cell lines or cells from aborted fetuses. John Berhaney with the National Catholic Bioethics Center spoke to Currents News about this concern and if both the Moderna and Pfizer vaccines are actually ethically produced.
The Moderna vaccine and a Pfizer vaccine, which are closest to implementation, are not produced using the cell lines he references. Now, they did come in at a certain point in the process, sort of at a final stage of development in testing, but they are not produced using those cell lines like many other vaccines are.
The vaccines being developed by AstraZeneca and Janssen are reportedly produced using abortion-derived cell lines. Meantime, U.S. bishops are giving Catholics the go-ahead to take both vaccines, despite the remote connection to morally compromised cell lines. They released a statement saying receiving one of the COVID-19 vaccines ought to be understood as an act of charity toward the other members of our community. In this way, being vaccinated safely against COVID-19 should be considered an act of love of our neighbor and part of our moral responsibility for the common good. Teachers in the Diocese of Brooklyn are lining up by the hundreds to take part in that act of charity. Faculty from Catholic schools are now being included in the city's new expanded vaccination plan. Currents News' Emily Druby has the story from a vaccination site in Jamaica Hills where there's hope, but also concerns.
A steady stream of people heading into this Queens COVID vaccine hub as the list of those who could get shots dramatically expanded. People over 65 just added, bumping that list up to 7 million people. It includes police officers, firefighters, and teachers. Initially, Catholic school teachers feared they wouldn't be included, but after strong requests from Catholic leaders in both the Diocese of Brooklyn and the Archdiocese of New York, they were. Many have already taken advantage.
So it looks like this.
Ashley Lance shows us the portal she used to sign up for her COVID vaccine. The St. Kevin's Catholic Academy teacher got her first shot and is signed up for her second.
I went right online to the vaccine hub, found my appointment, and said, you know what? The sooner the better.
For her, the process was easy because she signed up right away. But now that word has spread, others haven't been as lucky. She knows teachers who are waiting months for their slot. New York City has a portal for finding vaccination sites. You just add your zip code and local spots pop up. Now the trick is getting an appointment. Many places are booked up. The governor of New York urging patience as they open up more vaccination sites. John Santamaria, a teacher at Our Lady of the Snows Catholic Academy in Glen Oaks, booked an appointment in Queens after hitting a dead end closer to home.
Sites out in Long Island haven't really been as friendly as the city ones, so I took what I was able to get, making sure I could do it immediately.
Now he's having trouble booking a Long Island appointment for his mother. He's not the only one.
Long Island, I was not able to find anything.
St. Kevin's teacher Janet Campo also booked a Queens appointment after running into trouble on the island. She signed up her grandparents too. But that doesn't mean in-person teachers get the vaccine first. Right now, there's no system in place to make them a priority over teachers who are remote. It's just the honor system, many calling it unfair.
People who are teaching remotely should not be getting the vaccine before people who are putting their lives on the line every day to come in and teach the kids.
The governor raising concern that even with all of these people eligible, they're still only getting 300,000 doses a week from the federal government. In Jamaica Hills, Queens, Emily Druby, Currents News.
One of the healthcare organizations on the front lines battling COVID is faith-based Somos Community Care, a network of 2,500 doctors who have worked with the city's most needy since day one, testing over 800,000 people, many of them immigrants in underserved communities. But they've had a tough time getting their hands on enough vaccines and convincing a hesitant immigrant population that the vaccine is safe. So they've pumped in over $1 million on a vaccination campaign that focuses on trust between the community and their healthcare providers.
How wonderful it is to have providers, physicians that know you, that you trust them, that you could explain to them and guide them and provide trust in what is being done.
As Somos' education campaign continues to ease fears among its most vulnerable, the nonprofit says it has 125 teams on standby, ready to distribute 7,000 more vaccines as soon as the state makes them available. With 2 vaccines currently available and more on the way, many Americans are wondering, which shot should I go for? Currents News' Michelle Powers reports on which vaccine is recommended by medical experts based on individual needs.
2 coronavirus vaccines currently have the green light in the U.S. The first is Pfizer's vaccine, 2 shots given 21 days apart. This one is recommended for anyone 16 years and older. The second is Moderna's vaccine, again 2 shots. But this one is given 28 days apart and is recommended for those 18 and over. Research is still being done to determine whether these vaccines are safe for children and younger teens. If you're pregnant, you can choose to get the vaccine, but you should know that these vaccines were not extensively studied in pregnant women, so there's limited safety data to look at for that group. On the other hand, COVID-19 itself poses a risk for pregnant women. The CDC says that some women who contract the virus are at an increased risk of severe illness and might also be at an increased risk of having a preterm birth. Both Pfizer and Moderna created mRNA vaccines, which aren't thought to be harmful for a nursing child, and that's according to the CDC. For those who are immunocompromised, you can choose to get the vaccine, but these shots weren't substantially studied for your underlying health conditions. So there's not enough data on how safe they are or how effective they are yet. On the other hand, getting infected with COVID-19 can be risky for people with compromised immune systems. For those with allergic reactions, the CDC says you shouldn't get the shot if you're allergic to the components in these vaccines, and you can review those on the vaccine's product labels. Michelle Powers, Current News.
But another big question we have is, will the vaccine protect you from variants of the virus? Research suggests the Pfizer shot does protect against the 2 that have emerged in Britain and South Africa. Those strains have been detected in several states in the U.S., including some in the tri-state area. Dr. Robert Tabali, an infectious disease expert with the Catholic Medical Association, explains how the variants might be less scary than they seem.
Now, this strain is not any more severe to our knowledge than the other strains of coronavirus. And another strain has been identified in South Africa, which does have a bit of a change on the spike protein, which is actually the kind of nails spiking out of a tennis ball model of the virus, and that's what attaches to the human cells. Now, if viruses spontaneously mutate even further and change that spike protein further, it's possible it may become non-infectious to humans.
Dr. Tabali went on to tell Currents News some other exciting news. There is another vaccine in the works called Novavax that looks just as promising as the leading 2, and it may give Catholics a clearer conscience.
This one is very exciting because it doesn't have any of the Catholic ethical dilemmas of association with aborted fetal cells. And so this may become available in the next couple of months here in the United States.
Experts say the Novavax might be easier to distribute and store since it can remain in the refrigerator for up to 3 months. There's a lot more news headed your way on this special edition of Currents News.
I know that I had a professional responsibility as well as a civic responsibility to do what I can.
The first person in the United States to get the COVID vaccine has received her second shot. We'll talk to critical care nurse Sandra Lindsay. The Vatican has begun its distribution. We'll go to Rome for the latest. And lessons from the past. We'll take a look at how New York City stamped out the threat of a smallpox outbreak in just weeks.
I've completed kind of the marathon. I've closed the loop.
That's nurse Sandra Lindsay, America's first vaccinated nurse receiving the second dose of her coronavirus vaccine. The critical care nurse is now fully vaccinated against COVID-19. We spoke to Sandra shortly after her second shot and asked the director of critical care at Long Island Jewish Medical Center in Queens how she was feeling after her 2 doses.
I am feeling great. No side effects at all from either shots of the COVID-19 vaccine.
That's great to hear. Tell us, what made you volunteer to be one of the first to get the vaccine?
So having seen all the harm and the pain and the suffering, I know that I had a professional responsibility as well as a civic responsibility to do what I can to put an end to this vaccine. So I did it to protect myself, my family, but also everyone around the world who I may come in contact with or who I may pass it on to, and then they come in contact with someone else.
So many people are still unsure about getting it. I mean, I know I've spoken to friends who are like, I'm not getting it yet, it's too soon. And even the mayor's press conference he had, they were talking about people that work at hospitals are saying they don't want to get it yet. What do you say to everyone to ease their fears about getting the vaccine?
So I would say I would listen, not to dismiss anyone's fears or concerns, but also, ask them to go back and take a look at the study, look at the participants, look at the results. Also use people like me and so many other of my colleagues and healthcare workers around the world who have taken the vaccine and share their experiences similar to mine, that it is safe. They're not having any adverse events, at least anything serious related to taking the vaccine, and that getting COVID-19 is deadly. It is real, and it's not to be taken for granted.
Archbishop Thomas Wensky of Miami was the first Catholic bishop in the U.S. to receive the vaccine. I spoke with him about the ethics of getting the vaccine.
Actually, it is ethically a positive thing to get vaccinated, because it is a social good. And getting vaccinated, we not only protect ourselves, but we also protect others.
Archbishop Wensky says he hopes to set an example for Catholics to get vaccinated, sharing the USCCB's sentiment on the morality of the vaccines. Meanwhile, the Vatican isn't just approving the vaccine, they're distributing it as well. The Holy See has acquired an ultra-low temperature freezer to store the vaccines, and a set of criteria has been established to decide who gets it first. Currents News' Jessica Easthope has more as the Holy Father got in line.
The Holy Father is halfway to being immune to COVID-19. Pope Francis received his first dose of the coronavirus vaccine as the Vatican began its rollout. And Vatican sources are reporting Pope Emeritus Benedict XVI is also scheduled for his first dose. Vatican City was provided with specialized freezers to store the Pfizer vaccines, which researchers and church officials declared was more morally sound than other options like AstraZeneca's vaccine, due to the amount of cell lines used from aborted fetuses.
It does not produce other abortions, but it uses the cell lines already present in the laboratories. Material involvement means that receiving the vaccine does not share the intention of the person who performed the abortion.
Paul VI Hall was transformed into this hospital setting. Pope Francis reportedly among one of the first of the 450 Vatican residents to get the first shot. In a statement, Pope Francis expressed his support for the vaccine as a moral obligation. He said, quote, "Ethically, everyone must get the vaccine. It's an ethical option because your health is at stake, your life, but also the lives of others." The Vatican's vaccine rollout marks the beginning of the end of a period of concern for the Holy See. Over the last several months, more than 24 Vatican residents contracted the virus. Pope Francis's trips were canceled, and he began hosting his audiences virtually. An effort, he said, could never substitute being together when he did meet face-to-face with pilgrims in early September.
Dopo tanti mesi riprendiamo il nostro incontro faccia a faccia e non schermo a schermo, faccia a faccia. Questo è bello.
Now, this first round of vaccines is bringing that closer to reality. After all Vatican residents receive their first doses, it's expected any surplus will be given to people in need outside the Vatican. Pope Francis will get his second dose in 3 weeks. Jessica Easthope, Currents News.
There's more to come, and more questions will be answered on this special edition of Currents News, including details about one of the fastest vaccination rollouts in history.
It was absolutely typical New York. Line up, shut up, keep moving, and get your vaccine and move on.
That's the Big Apple at its best, how it beat back a smallpox outbreak that threatened to devastate the city. The amazing story coming up. New York City was at the heart of the coronavirus pandemic when it began spreading across the country. But that wasn't the first time the Big Apple faced an infectious killer. Back in 1947, smallpox threatened the city. And the city fought back with one of the most ambitious and well-executed public health campaigns in its history.
Please remember that it is only vaccination that is a protection from the dire ravages of this very serious disease that leaves in its trail death and destruction.
That was New York City Health Commissioner Israel Weinstein in 1947, urging all New Yorkers to get vaccinated after an American businessman contracted smallpox during a trip from Mexico and later died in a New York City hospital where others soon became infected.
In 1947, there was a small but scary outbreak of smallpox in New York City.
The scare launched a citywide scramble to keep New Yorkers safe from a deadly killer whose presence dates back 3,000 years. Infectious disease expert Kent Sepkowitz studies outbreaks past and present and says smallpox was an even bigger threat than COVID-19.
Smallpox was a much more fatal disease if acquired. And among survivors, it was quite disfiguring. Could lead to blindness and a lot of other problems.
Smallpox killed an estimated 300 million people in the first half of the 20th century alone. 30% of those who contracted the disease died, prompting the city to spring into full crisis mode.
It was bad enough that the mayor and the Department of Health both decided that the entire city had to be vaccinated. It was a city of about 7 million plus people at that time in 1947.
Tens of millions of doses were distributed, vaccinations were free, and a coordinated public education campaign helped spread the word. Archivist Katie Ehrlich with Municipal Archives works with the valuable remnants of New York's history that tells the story.
The vaccination programs that the city implemented, around the mid-20th century were really highly organized and kind of all hands on deck, setting up free health clinics, setting up points of contact where New Yorkers could go and get these vaccines, and it was really targeted to specific populations in terms of who the city thought was more perhaps vulnerable to these specific outbreaks.
Less than a month later, millions of New Yorkers had been vaccinated, and the public health emergency declared over. 4 to 5 million people in all, including part of the tri-state area, were vaccinated over a 2-month period.
It was something to be proud of. It was New York style. It wasn't, completely everyone behaving, but it was something that is a real achievement. And the success of it was that we were still really in a let's do this for America moment. We were very much in a taking orders is okay moment. That's how you get things done.
The 1947 smallpox scare marked the last major outbreak in the country. Smallpox was officially eradicated in 1980. And that is Currents News. I'm Christine Persichetti. Thank you for joining us for this special edition of Currents News, because we are putting your faith in the news. Hope to see you again next time.